Physical activity, by definition, is any bodily movement produced by the contraction of the skeletal muscles that result in a substantial increase over resting energy expenditure. But how I like to define it is just simply any movement that is generated by oneself. Fitness is a general term to describe the ability to perform physical work, or in other words, the quality of which someone can physically complete particular tasks relating to one's current level of health. Endurance is the ability in which one is physically active for a prolonged period of time with the ability to resist fatigue. Endurance is also a measurement of fitness. With aerobic training comes benefits for heart rate, blood pressure, stroke volume, and cardiac output. With heart rate, it decreases at rest due to improved efficiency of the heart, meaning it requires less beats to circulate blood. With blood pressure, it also decreases at rest, which is very beneficial, especially for those who have hypertension. It will also improve your blood pressure while exercising, and it will create less strain on the heart. For your stroke volume, it correlates along the lines of your heart rate and your blood pressure due to the fact that it will increase, meaning the heart will become stronger and the blood pumping of the heart will become more efficient. For your cardiac output, it will increase during exercise as the heart grows stronger and more efficient. It will help deliver better quality of oxygenated blood to the muscles. The harmful effects of sitting too much or an inactive lifestyle can be detrimental to one's health. It can cause your muscles to atrophy or shrink, which can then lead to many muscle dysfunctions. It can reduce the blood flow in your body, which can then lead to many cardiovascular issues. It will overall decrease quality of life and make everyday life more difficult to navigate. And to prevent these things is simply just move. Having movement, exercise, walk around, jog, for those who are unable to walk, any type of movement. Get the heart pumping, and it will get the muscles moving, get the heart pumping, and those things right there will help increase your quality of life when it comes to your heart and your muscles and everything else. Some precautions to consider when designing an exercise program for the older population is usually an overall health assessment, any past or current medical issues, such as diabetes or hypertension or any other chronic condition. What about a fall risk or any other limitations? Then I would consider progression through exercise based on one's fitness level, starting small and working your way up. Making sure every exercise is safe and compatible to one's limitations, but also always closely monitoring your patient for exercise intolerance, such as dizziness or shortness of breath. Always making sure the vitals are within a safe and treatable range, especially with those who have chronic conditions.